Poultry destruction, carcass disposal, cleaning and disinfection procedure during the outbreak for the poultry health operator. It is under supervision by the Department of Livestock Development, Ministry of Agriculture and Cooperatives. Preparation for poultry destruction, carcass disposal, cleaning and disinfection during the outbreak includes health preparation of the poultry health operator, clothing and personal protective equipment for the operator, materials and equipment for operation. The Provincial Livestock Office, in cooperation with the Public Health Office, will designate the disinfection team. The disinfection operator is selected from a person who has no history of chronic heart diseases, chronic respiratory diseases, kidney diseases, and has received a flu vaccine not less than 2 weeks, but not more than 1 year before operation. Materials and equipment for operation. Materials and equipment for poultry destruction. Poultry carrying containers, canvases, carbon dioxide gas, excavators, incinerator, plastic strips or ropes for displaying the restricted area. Materials and equipment for cleaning and disinfection. Disinfectants. High-pressure disinfectant sprayers or knapsack or backpack sprayers. Disinfectant containers for food baths. Disinfectant containers for personal protective equipment. Disinfectant container for egg tray. Detergents. Bathrooms or changing rooms. Steps for wearing protective clothing and personal protective equipment. The disinfection operator must follow these steps. The operator wears the protective clothing or the long-sleeve shirt with collar and long trousers. Then, the operator wears the boots and let the trousers legs out of the boots. The operator puts on thin rubber gloves. Let the shirt sleeves cover the thin rubber gloves. Then put on heavy rubber gloves. Let the gloves cover the shirt sleeves. Apply safety mask to the face with aluminum strip on the top. Then put ear loops around ears. Use index finger to press aluminum strip on the bridge of the nose. Test it again by putting hands around the safety mask, wrap around, and breathing heavily. If the air leaks at the mask edge, put a finger on the aluminum strip or adjust safety mask to a new position. Finally, goggles and a head cover are worn. The disinfection operator must wear protective clothing and personal protective equipment at the changing room or bathroom, which is far away from the disinfection area. Example of proper wearing protective clothing and personal protective equipment. Protective clothing. Boots. Thin rubber gloves. Heavy rubber gloves. Safety mask. Goggles. Head cover. Poultry destruction, carcass disposal, cleaning and disinfection procedure during outbreak. Poultry destruction and poultry carcasses disposal. For a small number of poultry, less than 100 heads, the cervical dislocation method is suggested. Gas killing is used for mass destruction of poultry. For a small number of poultry, less than 100 heads, prepare the burial pit which the top of poultry carcasses is deeper from the soil surface at least 50 centimeters. The burial pit is not in a proximity to the water resource and the area of stagnant water. Place the plastic strips or the barrier ropes around the pit for designating the restricted area. Pour lime into the bottom of the burial pit. Disinfectant is sprayed into the pit thoroughly, including bottom and the lateral surface of the burial pit. The operator must humanly kill poultry before burial. The cervical dislocation is used for poultry killing. Use one hand to grasp the head with the index finger and the middle finger. Use the other hand to grasp the neck and the body. Stretch the neck and the body out sharply to separate the neck vertebrae and the spinal cord out of the skull. After poultry death, put poultry carcasses into double-layered bags. Spray the disinfectant inside the bags to cover poultry carcasses and tie the bags tightly. Bring these bags into the burial pit. If any materials, equipment, or bedding are found at the infected area, spray disinfectant onto this item before burial. Cover the pit with soil tightly and add the lime onto the burial site. Spray disinfectant on the burial site again. If the burial site is possibly uncovered by carnivores, cover the burial site with the bricks or stone. After finish the burial procedure, the excavator is disinfected thoroughly to prevent disease spread. Gas killing is used for mass destruction of poultry. The step includes: prepare the burial pit, which the top of poultry carcasses is deeper from the soil surface at least 50 centimeters. The burial pit is not in a proximity to the water resource and the area of stagnant water. Place the plastic strips or barrier ropes around the pit for designating the restricted area. Pour lime into the bottom of the burial pit. Disinfectant is sprayed into the pit thoroughly, including the bottom and the lateral surface of the burial pit. Put the poultry into the plastic container. 10 to 15 heads are in each plastic container. More number of poultry can be put in the plastic container as properly fit. All containers are located in the restricted area located by plastic strips. Cover the poultry carrying container with a lid or canvas tightly. Use carbon dioxide at ratio of 3 kg per 1,000 cubic meter for at least 30 minutes to ensure the suspect of infected poultry are peacefully dead. Put the poultry carcasses into the burial pit. If any materials, equipment, or bedding are found at the infected area, spray disinfectant onto this item before burial. Cover the pit with soil tightly. The lime is sprinkled on the burial site and disinfectant is sprayed on the burial site again. If the burial site is possibly uncovered by carnivores, cover the burial site with the brick or stone. After finish the burial procedure, the excavator is disinfected thoroughly to prevent disease spread. Cleaning and disinfection procedures. Feces, materials and equipment used inside the poultry house and egg tray. Vehicles, poultry house. Disinfection method for feces. Pour water on feces, let it soak. Collect feces until the height of the feces pile is at least 1 meter. Cover the feces pile with canvases and leave for 3 days. After passing 3 days, open the canvas and spray disinfectants onto the feces pile. Take the feces pile into the plastic bag, then tie the bags tightly. Move the feces bag onto vehicle. The disinfection is sprayed on the bag thoroughly. Cover the bag with a canvas tightly before burial. In case no feces collected, pour water on the feces for all over the poultry house. Water usage is at the ratio of 3 ml per square meter. Disinfection for materials and equipment inside the poultry house. Spray the disinfectants throughout the poultry house from the top to the bottom area. Leave the disinfectant for at least 30 minutes before removing any materials, Equipment: bedding or waste. Sweep and remove any waste such as feed, feces, cobwebs at the roof corner for burial. Wash and scrub to remove grease, dust, dirt, feces especially at the floor, battery cages, egg throws, and dirty items. Soak equipment thoroughly in the disinfectants for at least 10 to 30 minutes. Spray disinfectants around poultry house in the morning and in the evening at least 2 to 3 times per week during the outbreak period. Disinfection method for the egg tray. Scrub, wash and clean the egg trays with detergent. Dip the egg trays in the disinfectant for at least 30 minutes. Wash the egg tray thoroughly with clean water. The final step is to dry the egg tray to be ready for next use. Disinfection method for vehicles. Mix the disinfectants as recommended by manufacturer's instruction on the label. Spray disinfectant with the high-pressure sprayer on the vehicle from upper area to lower area and wheels thoroughly. Disinfection method for the poultry house. Spray the interior of poultry house with disinfectant thoroughly. Start from upper area to lower area and leave the disinfectant for at least 30 minutes before removing any materials, equipment, bedding or waste. Collect litter around the farm for burial disposal. Spray disinfectants on the burial site. Sweep, clean and remove any grease of waste or feces on the floor surface of the poultry house. Spray disinfectant inside and around the poultry house. Spray disinfectants from the roof to the floor area again. The disinfection is operated in the morning and the evening at least 2 to 3 times per week. The downtime period is at least 20 days or as stipulated by Department of Livestock Development. The implementation after finishing the poultry destruction, carcass disposal, cleaning and disinfection during outbreak. After finishing the disinfection, the operator must take off personal protective equipment, PPE, by following these steps. Take off the boots and place the boots in a glutaraldehyde disinfectant container for at least 30 minutes. Wash and dry the boots. The cleaned boot can be reused. Then take off the thick gloves and place them on a container or plastic bag for disposal by burying or burning. Next, take off goggles and rub or spray them with glutaraldehyde disinfectant. The goggles can be reused. Then, remove the safety mask, protective clothing, and the thin rubber glove. By rolling inside out, place them in a container or plastic bag for burial disposal. After finishing taking off the PPE, the operator takes a shower and changes the new clothes. For the clothes of the operator, clean the clothes with detergent or glutaraldehyde disinfectant. Healthcare after operation. The DLD officer coordinates with the public health officer for setting up officer to check and monitor health of the operators as well as his or her member of the family closely, at least 7 days after finishing the operation. Besides, there is a coordination among the public health volunteer of the villages to visit the area where the usual sick or dead poultry are found, and to search for the patient and the community for at least 14 days. If the patient is found, he or she will be treated immediately. Within 7 days, if the operator shows signs of flu-like symptoms or respiratory illness such as high fever, headaches, body aches, weakness, sore throat, cough, or eye infection such as conjunctivitis, he or she must see a doctor in the diagnosis or treatment immediately. History of poultry contact or operation must be reported to the doctor.